It gives me great pleasure here in my practice at Riverview Aesthetic Surgery to perform breast reconstruction on patients undergoing mastectomies and extended lumpectomies, and patients who have had issues due to radiation and lumpectomies due to breast cancer. When a patient gets a diagnosis of breast cancer, it is a devastating thing to hear. It's hard for the patient, it's hard for their family. It gives me great pleasure to be the silver lining in the cloud of breast cancer, to let patients know that I am going to restore their breasts to as good as, or possibly even better than they were before. That we are going to recreate the breast of their dreams. Whether they've always wanted to be big or small or lifted or perky, they are going to get the reconstruction that matches their body type, that fits their needs, and that is as comfortable as possible for these patients. The surgery is customized to the patient's needs. Some patients will want implants for their breast reconstruction. Some patients will want a muscle flap. Some patients will want fat grafting to achieve the most natural breast reconstruction with the most limited surgical time. A typical implant reconstruction with a tissue expander takes 2.5 hours under general anesthesia at the end of the mastectomy. These patients wake up with a small breast mound at the end of their mastectomy and regain confidence by not waking up flat and deflated looking after their mastectomy. Typically, a breast reconstruction with a tissue expander will involve 2 to 3 surgeries. We'll first stretch out the skin with the expander every week in the office to achieve the size and shape of the breast that most fits with the patient's desired look. And the second procedure will exchange their tissue expander for a silicone breast implant. Our staff is very supportive and warm, open and encouraging, and we take the time to educate our patients about all their reconstructive options. We'll spend a great deal of time getting to know the patient and making sure we choose the right reconstruction for their needs.